Hey folks, so don't have anyone on our Zoom feed, but that's okay. We'll get started because I know there's folks on Facebook Live, and as usual, this will be recorded on Facebook Live as well as YouTube. So if you miss any of this, you can catch it on those services. Um, as usual, if you have any questions or comments, please shoot them up in the chat on Zoom or on Facebook Live. I'll try to get to those. We should get started. It is noon, and as usual, there's a lot to cover. So globally, things are looking okay. Looks like we've peaked and we've started to go down a bit. So cases have declined quite a bit actually in the last few weeks. So it looks like globally it's good news because the number of new cases have declined. So a few hotspots, but a lot of the former hotspots are showing. Seems like their surges have peaked. So that's really good news. There is a little bit of a blip there, and that's probably due to reporting delays because of Labor Day weekend in the US. And because the US is such a considerable part of this surge, even if it was just a delay in the US, it actually shows up in the global charts. So great news in terms of cases globally, as well as the decline in deaths. So again, globally, good news. You can see the hotspots, however. So it isn't consistent. It isn't we have seen declines in many hotspots, including the US a little bit. We'll get to that later. But there are still some hotspots that are not, that are continuing to struggle. For example, Malaysia is now in, I think, they've been going through this search for several months now, and it seems like they just can't do anything about the numbers. They have a fairly strict shutdown, yet they still struggle to get their numbers lower. So they're still surging. I think in recent weeks, there has been a little bit of a decline, but they're still struggling. Mongolia is struggling again. So even though they have a high percentage of their population vaccinated, they continue to struggle with really high numbers. The UK is still not out of the woods, neither is Israel. And that's going to be of particular interest to us because these are highly vaccinated countries. And we can actually learn quite a bit about which direction our surge in the US will go by looking at Israel and the UK. There's a few other countries in Europe that are also that are starting to struggle as well, particularly in Eastern Europe. It seems like the Delta surge is now shifting towards the east. Spain, France are doing better, but you're getting surges in Romania, Serbia, the Baltic states, Norway. So we still continue to have hotspots, even though overall globally we're looking better. You can see this if you look at as far as death. I'm sorry, this is deaths. Oh, that's wrong. Sorry, that's the wrong map. Well, let's look at by continent. So if you look at by continent, you can see that Asian numbers are starting to decline. Indonesian numbers are far better now, so I think that's helped quite a bit. So Asian numbers are continuing to decline, although it's not consistent. And that's to be expected given Asia is a big continent. North American numbers are starting, as you can see, it's starting to plateau a bit. They're starting to show indications that it is starting to plateau and perhaps start to decline. So there's some good news out of the US. Again, we're talking about a big country. There are states that are seeing surges, however, so it is not consistent. European numbers have a steady increase. Again, that shift towards Eastern Europe is concerning. South American numbers continue to decline, so that's great news. Africa as well, but it's hard to say with Africa. There are some countries in Africa that are seeing surges, but that could be because of just reporting issues or increased testing. It's hard to say with Africa. I struggle with African numbers, trying to make sense of it, particularly trends. And then finally, Oceania. Australia's lost control of their numbers. It's not showing up here, of course, because we're not talking about a huge population, but Australia, I'll show you Australia in a bit. has lost control of its numbers. So if you look at case counts, the US still leads the way, but about 150,000. Not great. India is second. So India, even though they had that huge tragic surge a few months ago, and then, of course, their numbers went down, they're still not out of the woods. They still have a relatively high number of cases every day. And again, with India, you have to assume that this is a huge underestimate. So India is not out of the woods yet. And in fact, they moved up a little bit. UK is third. So UK continues to struggle. They looked like they were going to go down, then they started to go back up. Some of that could be due to increased testing. So the UK has a really robust testing program. And so that could just be a lot of asymptomatic cases being detected through their very robust testing program. Then you can see Iran, Turkey, Malaysia is up there. I mentioned Malaysia, Philippines, Russia. Interesting note, the Russian Orthodox Church recently announced that if you do not get vaccinated, you are sinning and you will have to atone for that for the rest of your life. Pretty strong statements. And hopefully that'll help their vaccination campaign because it's stalled quite a bit. Vaccine hesitancy. We talk about vaccine hesitancy in the US, but it's a problem all over the world, unfortunately, including places like Russia, a lot of Western Europe, Australia, even East Asia. So, and then you can see the rest of the list. There's some countries that continue to struggle. For example, Thailand, after successfully fighting off the pandemic, is now seeing a huge surge. Same with Vietnam. Israel, you can see, is up there, unfortunately. Cuba continues to struggle. Cuban numbers have been concerningly high for a long time. But also notice that there aren't too many South American countries here. So that's really good news. This list was dominated by South America for the longest time. So South America continues to do well. In fact, epidemiologists are trying to figure out why South American numbers have declined so precipitously, and to at least give us some clue as to some of the dynamics of the surge in the U.S. So from a per capita standpoint, this list is dominated by Malaysia, the UK, Serbia, Georgia still continues to struggle. Israel, remember last week Israel was number one. They're no longer number one, but they're still really struggling, which is really concerning given the high percentage of their population that's vaccinated. Mongolia is up there. Believe that is Guyana. Cuba is up there. By per capita, if you look at continent, you can see that North America is still leading the way. But good news, it looks like we have kind of peaked a bit. We'll see if we can sustain that. It's hard to say because schools have just started. So if we're going to see a surge from schools starting all over the country, we're going to start seeing them probably this week and next week. So this might change. We'll have to see. I'm a bit concerned about that, quite honestly. School openings are always, from an epidemiology standpoint, always a bit of a nightmare because of the potential for rapid spread, especially given the lack of vaccination in the under 12 crowd. And then, of course, the anti-mask and anti-vaccine sentiment, which is really concerning. Europe is now number 2. They're kind of steady from a per capita standpoint. South America continues to decline, so that's great news. They're now below Europe. By the way, North America leads all the continents in terms of per capita cases by a considerable margin. So this is mostly driven by the US, but Canada numbers aren't great either. And then you can see Oceania is above Africa, close to Asia. And this is driven by Papua New Guinea, which is seeing a surge, as well as Australia's little surge. Like I said, their zero COVID campaign, unfortunately, has failed. So, like I mentioned, Israel is now number 4. Last week, they were number 1. Grenada is number 1. Again, these Caribbean countries, these small island nations, if they get a surge, it becomes really hard to control, especially in these island nations that are so dependent on tourism and also just lack the public health capacity. So you see Grenada, Dominica up there, St. Lucia, you see St. Kitts, so Bahamas, Antigua, some really wonderful Caribbean islands that I would love to be in if it wasn't for COVID, but they're really struggling with those numbers. I think it also coincided with the increase of tourism from the US. So yeah, and it's one of those no-win situations, given that these economies are so dependent on tourism. Without tourism, their economy grinds to a halt. So yeah, and by the way, this is why Hawaii is seeing a surge. Hawaii is, of course, one of the most vaccinated states in the country, yet they saw a surge, mostly driven by tourism. I know, I mean, anecdotally, a lot of folks that have gone to Hawaii on vacation. And it's to the point that the Hawaiian governor has actually pleaded with folks to stay out of Hawaii until the surge is over. So anyway, so you can see a lot of those smaller islands here. Israel's up there, Cuba, Georgia continues to struggle. You notice Serbia is now up here, Kosovo. So a lot of these Eastern European countries are starting to show up on this list as Delta shifts from the western part of the continent to the eastern part. North Macedonia, Albania, Slovenia, Switzerland. So in Europe, it is just kind of shifting over. Good news is that Spain, Portugal, Italy, France, those numbers seem to be better as of late. Germany as well, Sweden, Finland, Norway is seeing a bit of a surge. And then you can see Eastern Europe. So if you look at the changes here, the red indicates those countries with the biggest 1 week increases. The blues indicate decreases, and the deeper the color, the bigger the increase or decrease. So you can see that you have some significant surges in Slovenia and some of the eastern parts of the continent. But you do see some good news in Ireland, France, Italy, Spain, and Portugal, as well as Germany. And you can see good news. There's a little bit of a mini surge in Ecuador and Peru, but really good news in South America as well. Their downward trend is continuing, and hopefully it will continue for the foreseeable future, but it's hard to say. We're still trying to figure out what the dynamics of the decline is in South America. You can see Australia is seeing a bit of a decline here. Asia is doing relatively okay, with the exception of Mongolia. Mongolia continues to struggle, as well as Turkey and Syria. All right. So just a few countries, you can see Malaysia's numbers have starting to decline. So you can see that their present surge really started 2 or 3 months ago, and it's just continued. And they've had a hard lockdown, and yet they've continued to struggle with Delta. It's just so transmissible. And of course, their vaccination rates aren't as high. They just did not have access to the vaccines. But it's some good news. In recent weeks, they are starting to decline, so that's really good news. They've struggled for quite a while now. Mongolia, again, they seem to just each peak seems to be higher and higher and higher with Mongolia. And this is a bit of a conundrum too, because Mongolia has one of the highest vaccination rates in the world. Now, granted, it's probably with some of the Chinese vaccines, which may be less effective. And we don't really know how effective the Chinese vaccines are against Delta. So it's hard to say. I don't know much about the Chinese vaccines, so I'm not saying that they're bad vaccines. We need those Chinese vaccines because honestly, they are sharing those vaccines with the rest of the world, and they're doing a much better job distributing it to the rest of the world, much better job than we are. So I'm not here to denigrate the Chinese vaccines, but I don't know much about them, particularly their efficacy against Delta. Israel numbers. It's a real concern with Israel because, again, they do have high vaccination numbers, but then you realize they've been stuck around 65, 66% of their population vaccinated, and that hasn't budged for months. Now, is this surge due to Delta? Is it due to waning immunity? I am still, and I've been saying this, and nothing I've seen so far has changed my mind. But that is subject to change. I don't think it's waning immunity. I think it's just Delta, quite honestly. And the fact that a significant proportion of the population is still not vaccinated. Delta is that transmissible. I mean, 65, 66% might have been fine for Alpha or one of the previous, older variants or the wild type. But with Delta, 65, 66% just isn't enough. It's still going to spread rapidly. And given that it can spread in asymptomatic folks, and infection, and these vaccines aren't as great at preventing infection, yeah, I can totally see this surge even within a highly vaccinated country. So I'm still not convinced that it's waning immunity. I'm just not. I still think that those vaccines are better off in the arms of folks who have zero immunity, meaning the unvaccinated, than they are in people who already have immunity. They're just kind of topping it off. Norway surge, that was a pretty frightening surge right there. It just went straight up, as you can see. And that's very characteristic of Delta. When you have a R0 of 4 or 5, it spreads very rapidly. When you're talking about, and then a shorter incubation period, boom. I mean, it gets big very, very quickly, as you can see with Norway. It seems like things have calmed down a bit. It might have peaked. That's another characteristic of Delta. It seems like the peaks and valleys are much sharper, and just overall really much more unpredictable. Here's the UK. Proves my point exactly. Huge spike and then decline, and now it's going back up. So, and it's kind of hard to predict where it's going to go. And because of its transmissibility, even small events, any social event can really exacerbate and cause these spikes. So again, Eurocup probably created the spike. We're seeing it in the US, Sturgis in South Dakota, because they thought Sturgis was a good idea, even after their experience the last Sturgis. Fool me once, shame on me. Fool me twice, shame on you. South Dakota and their governor and their government just, not much to say about it, at least in polite company. Romania, you can see their spike. So again, that shift towards Eastern Europe. You can see Serbia, they're approaching their previous peaks. And just look at that, again, you look at that line just going straight up. So, this is characteristic of a country that has relaxed its social distancing rules, relaxed restrictions, perhaps eliminated masks. This is what happens. And here's Australia. So again, just keep in mind, we're talking about, you look at the y-axis, and we're talking about magnitudes difference, but we're also talking about a country that had almost 0 cases for the longest time, and then boom, 1 single case of Delta in Sydney. They failed to control for it, and this is what happens. It is now out of control. They're going to have to find a different strategy. They're now, again, Australia, New Zealand, Taiwan had a very different strategy towards COVID because they were at such low levels, and being small, being less populated island nations. They had a very different strategy than, say, Europe or Asia, or large Asian countries, or the US. They're going to have to use a strategy similar to ours because it is now out of control. So it looks like their goal is no longer 0 cases. You can't. Your goal is to just control it, and learn to live with it. So just to mention again, Canada numbers aren't great either. Not nearly as bad as the US, but I know Ontario, news out of Ontario is grim. The hospitals are filling up, ICUs are filling up. So Canada numbers aren't looking great either. But my guess is Canada has a much greater percentage of their population vaccinated now. And so I think this, it looks like there's some evidence that it's starting to peak. I'm a little bit more confident if Canada peaks and starts to decline than I am in the US numbers, given the greater percentage of the Canadian population that is vaccinated. So yeah, so cases overall globally, it's looking better. Globally, they are going down. There are some hotspots, however, Eastern Europe, Mongolia, Malaysia, I didn't mention Turkey and Iran, who's continue to struggle. Smaller countries like Georgia, some of the Balkan states are having some issues. But overall, it seems like numbers are down. And a lot of that is driven by US numbers being down. We'll get to that in a bit. As far as deaths, of course, death is a lagging indicator, and deaths are a problem right now because you're seeing now the huge increase in deaths due to the surge this Delta surge. Now, I don't think deaths will get anywhere close to what we saw earlier, mainly because we do have a greater proportion of our global population vaccinated, particularly seniors who are most risk for death. So I don't think they're going to be as high, and all data indicates that is the case. But we are seeing now the wave of deaths that is following the Delta surge, and that is being led by the U.S. So you can see deaths in Asia because of lower vaccination rates and less robust hospital systems. They're going to have greater number of deaths. Their case fatality is going to be higher than North America. But North American numbers are second now. Europe third. Good news is South American numbers continue to decline. I think they've lost an entire generation of folks in South America, and so that's good news coming out of South America. You can see we lead the way, about 1,500 deaths a day. Some people think that's not a big deal. I'm not quite sure how they can think that. 1,500 people a day, that's a lot of people dying each day. Russia's second. So Russia's cases aren't as high according to official numbers. So that indicates that they're just not testing enough. They're not catching enough cases. Russia's struggling. And again, I mentioned before, they have a huge, the Russian Orthodox Church took a very bold step and just flat out saying, you don't get vaccinated, you're a sinner, and you're gonna have to atone for that for the rest of your life. That's pretty hardcore. Honestly, I'd love to see more religions say that. Because religion does have many people's lives, it has a significant role. So, but that's how serious things are in Russia. Mexico is third. Again, Mexico numbers just, they make no sense because you look at their official caseloads and they're way down the list, but their death, if you look at deaths, they're always in the top 5. So they're just not testing enough and finding enough cases. Indonesia's fourth, Iran, Brazil still struggling with deaths. We know case fatality in Brazil is much higher. Vietnam, some of these countries that are just, had these surges, they're now struggling with their surge in deaths, unfortunately. Now, what you do notice here is that with the exception of the US, most of these countries are middle-tier, middle-income countries. I say with the exception of the US because we'll get into that. But you can see that France is up here, Spain's up here, UK is up there, but they're fairly low down on the list. And again, that indicates that they have vaccinated folks. They've vaccinated their most at-risk folks, and they have clinical healthcare systems that can deal with COVID much better than these other countries, say Russia, Indonesia, or Mexico. So that's really what this tells me, that, again, those countries that can vaccinate and have more robust healthcare systems are going to have fewer deaths, even if they see surges. So from a per capita standpoint, Russia, you see the Eastern European countries are showing up, Georgia and the Caucasus right here, Malaysia, Indonesia is still struggling, Mexico's up here, and you can see North America leads the way in terms of deaths per million, led by the US as well as Mexico. Mexico is counted as North America for the purposes of this graph. You can see South America continues to decline. Europe is now above South America. So good news out of South America, bad news for Europe. Asia, Africa are doing okay. And then you can see this blip and it's kind of this plateau in Oceania. Most of those deaths are from Papua New Guinea, not necessarily New Zealand or Australia. So from a deaths per million, again, you see a lot of small Caribbean, a lot of island nations, small island nations like Bahamas, St. Lucia, Grenada, Jamaica is up there, St. Kitts is up there. And then you see a lot of smaller countries in Eastern Europe. So Kosovo, North Macedonia, you see Georgia, which is in the Caucasus region. Malaysia's up there. Sri Lanka is still struggling with that. Iran. So again, you look at this list, you don't see a lot of wealthier countries here. You see a lot of countries, kind of middle income countries. You see a lot of countries with low vaccination rates. You can see the changes. So you can see Eastern Europe is seeing a surge in deaths. Australia, which is unfortunate, and then of course North America. You're probably going to see a surge in deaths in Mongolia in the next few weeks, which is really unfortunate. Same with Norway. Yeah. In terms of vaccinations, well, I mean, we're vaccinating folks, not quickly enough. We're at about approaching 3.5 billion people vaccinated. China keeps adding numbers. They've been very, very sporadic in terms of reporting numbers vaccinated, but they are reporting it. You can see the countries with the greatest percentage of their populations vaccinated. So you can see there are countries with almost 80, approaching 90% of the entire population vaccinated, which means just about every adult is vaccinated in those countries. The remainder are probably children under the age of 12 who can't get vaccinated. I don't think any country has approved vaccines for under 12. If anybody, I think they're waiting for the US to take the lead on that, particularly with Pfizer. I don't know with the Chinese vaccines, if it has been approved for under 12 in certain countries. Remember, vaccine approval is country dependent. Oftentimes they will, especially countries without, they'll wait for the US FDA to rule, or maybe the Europeans or Canadians to rule before they make a decision. But I could be wrong, but I don't think there's any vaccines approved for the under 12, which means that in these countries, just about every adult is vaccinated. And we're not talking about small countries either. I don't have little kind of, is Luxembourg in here, or Liechtenstein, or any of these smaller countries? No, UAE is a weird place, of course. It's a very wealthy country, but Portugal's a big country. They have 86% of their population vaccinated. Iceland's a small country. Malta is a really small country. Qatar is again kind of like UAE, but Spain is at 80%. Spain's a pretty big country. Uruguay is a pretty big country. Denmark is a big country. China's now on this list because they've been reporting. They're at 76%. So they've been busy vaccinating their 1.4 billion people. That's a lot of vaccinated folks. So that's great news. So you have a lot of countries. Canada, I mentioned, they're at 74% of their entire population. So they're approaching most of their adult population vaccinated. I know for a fact Canada, they've not approved for under 12. And so they have just about all of their adults vaccinated in Canada as well. That's why I say when I see a decline in Canada, I'm a little bit more confident that that decline is going to be real. Whereas in the US, it's hard to say. So notice that Israel is on this list, but they're at the bottom at 69%. So I said 65 before, it's about 69%, or about 63% fully vaccinated. So, we consider Israel to be one of those highly vaccinated countries. Not anymore. Maybe we should be comparing ourselves to, say, Portugal or Spain, because, we have not. Israel is now at it's fairly low. So when you see a surge, and you see a surge with a disease or a virus as infectious as Delta, Delta looks at 62%, smiles, and just keeps infecting people. Weird analogy, I know, but you should hear my analogies I do in class. They're kind of bizarre. Ask my students about it. So that's why, maybe we don't compare ourselves to Israel. You can see that the UK is a little bit higher than Israel now. They're at 71% with at least one dose, 64% with fully vaccinated. Or Belgium at 71% fully vaccinated. Chile at 72%. Denmark at 73%. So we're nowhere close to that. So when you look at UK numbers and Israel numbers, I'm going to start saying, look, Israel, we always considered Israel to be highly vaccinated. I don't know if we can say that anymore. Now, granted, Israel is a younger country. There's a bigger proportion of their population that's not eligible, but it's not that young. So there's a huge group that is hesitant in Israel, and that's probably what's driving their surge, especially when you have a variant that's infectious as Delta. So let's take a look at Israel. So here are the numbers in Israel right now. This is their cases per million people. They touched on 1,000. Again, 1,000 is my threshold, just my personal threshold. If it goes above 1,000 per million cases per day, 1,000 cases per million people per day, that's some serious numbers. That's some really, really bad numbers. And Israel exceeded that, and that they went above their previous peak, which was earlier this year. And this is at a point where most of their country is fully vaccinated. It's kind of decline now, so it's good news. And so you can see, yeah, here's the thing though, their vaccine rates have not budged for a long time. They had this huge surge of vaccinations right up to about April, May, and then it just kind of stopped. They hit everybody who wanted to be vaccinated, and unfortunately, they weren't able to convince the rest of the population to get vaccinated. These aren't all kids either. So you can't, 40% of the population of Israel is not under the age of 12. So you have a huge group of eligible folks who did not get vaccinated, and that's going to drive surges. Okay, hospitalizations unfortunately were high as well. They weren't as high as the previous surge. So again, the vaccines do help, but it did go up. Luckily, deaths unfortunately surged, but not nearly as high as the previous surge. So again, this is really, really, I think, tells you how powerful the vaccines are. So you have a surge in cases that is greater. By the way, I think these numbers in Israel, because they have such a robust testing, a lot of them are probably infection. But you can see the effects of the vaccines, that deaths are half the rate that it was in the previous surge, even if the cases were greater than 100% higher. Let's look at the UK. So the UK numbers are kind of going all over the place. They're kind of going up again, looking like it's going to go down again, but not quite as high as a previous surge. Okay. However, look at UK hospitalizations. They went up, but not nearly as high as in Israel. So that's actually really curious. What this tells me is that the UK numbers, my guess is that these are a lot of asymptomatic or very mild cases. The UK has a really robust testing system. They test a lot, even compared to Israel, definitely compared to the US. So my guess is that a lot of these cases, this surge was probably asymptomatic cases, which is still reported because it's a positive case, but probably asymptomatic or very mild cases because very few of them are hospitalized. Look at the hospitalization rates per million. It was over 400 in the previous surge. It's not even 100 this time around. Meanwhile, cases are at 700 here and about 800 in the previous surge. Vaccines work against hospitalization. Deaths, not much at all. Yes, there is an increase in deaths. We're going to get that with a surge, but nowhere near the deaths we saw during the previous surge, which was absolutely horrific. This was back in January. And then here's the vaccination rates in the UK. And you can see that it's actually still going up. Now, some of you might say, oh, well, as you can see in the UK, most of the folks here, because they're still vaccinating folks, most of the folks who were vaccinated fairly recently. And therefore, that might be evidence that, and you compare this to Israel, most of the folks in Israel were vaccinated prior to about April. See how steep that curve is since January 1? And then you look at the UK, their vaccination didn't really start until March. And then the bulk of their vaccination actually occurred after April 1. So could that be evidence that in Israel, the vaccines are waning? That's why you're seeing higher hospitalization. Maybe. I would want to see more data because that's it's very ecological, right? I mean, it's just, comparing countries, and I talk a lot about the ecological fallacy. It's very ecological, but it's definitely curious. And it could be evidence that, yeah, vaccines are waning. I just don't see other evidence to support that as of yet. Okay. So the takeaway here is that, yeah, vaccines work. Vaccines work really well. And again, we need to kind of reconfigure. I think we need to get used to the idea of breakthrough infection. So breakthrough cases of COVID that are very mild or completely asymptomatic. I think there's way more of those than we are detecting because of our testing protocol in the US in particular. We don't test folks who are vaccinated. In fact, most folks who are vaccinated are excluded from most testing protocols. The people who are tested are unvaccinated folks. And so we're not detecting those breakthrough infections. Again, I'm differentiating breakthrough infections with breakthrough disease. Disease, symptomatic. Infections, asymptomatic. And I think there's a lot more breakthrough infections. And that's fine. I think those are okay because they're not ending up in the hospital. They're not causing symptoms. So vaccines are doing their job. We should really be focusing on symptoms and especially hospitalizations and deaths. Those are the numbers that we should be focusing on. And if you look at those metrics, the vaccines are incredibly effective against Delta or any other variant. And so we need to stop getting hung up on breakthrough infections. They're going to happen, unfortunately. My guess is about all of us are going to get COVID eventually, vaccinated or unvaccinated. In the vaccinated, it's going to be mostly mild, maybe completely asymptomatic. Unfortunately, some of us will end up in the hospital, some of us will die, but the risks of that happening are incredibly low. But most of us will end up getting COVID. And if you're vaccinated, it's going to be very mild. And as we start to coexist with COVID, it is going to become milder, milder, milder as more of the population has some immunity towards it. So that's an idea that I'm starting to really, really get out there. Most of us will get COVID. But we should still be careful right now because there's still a population that's incredibly vulnerable, and that is kids. I'll get to that in a bit. So let's talk about the US. So US, showing some hints that we are plateauing. I'm not super confident in this. I'm hopeful, but not super confident, not as confident as in some other countries. You saw the numbers in the UK that kind of went up and down and then kind of went all over the place. Delta's really highly, it's just unpredictable that way. Right now, my big concern is schools. Schools have opened. Will we see a surge in kids and kids spreading it to their families, household transmission, even in areas with high vaccination? That's the big thing right now. That's my big concern. Some of you might say, well, school started like 2-3 weeks ago. Well, no, not really. In a lot of areas of the country, school just started. They start Labor Day. So they started this week. We're not going to see those cases until probably in the next couple of weeks. So this will be interesting. Also, because of hurricanes and natural disasters, there's going to be delays in reporting, particularly in Louisiana and Mississippi. Those are hotspots right now. There's going to be delays in testing because, well, quite honestly, they have bigger issues they're dealing with. So I'm cautiously optimistic, but my confidence is not extremely high in these numbers right now in the US. Right now, Tennessee, just look at Tennessee's numbers. They're kind of all over the place. And of course, Tennessee had that horrific flooding. And so, Tennessee's now the hotspot. But you can see overall in all regions, but particularly in the South, we are seeing declines. And that might just be the natural progression of Delta. It seems like it has a pattern of peaking quite sharply and then declining, and then just waiting for that next chance to peak again. as long as there is enough of a population that has no immunity. We'll see. Or could we have maybe just infected just about everybody? And that's why it's going down? That the population of susceptible hosts is declined to a point where SARS-CoV-2 is having trouble finding viable hosts? Talk about that in a bit. But yeah, all regions is declining. By the way, including in the Northeast. That's good news. Northeast, of course, has the highest vaccination rates, but also in the Midwest and the West as well. So here are the hotspots. It seems like it's kind of shifted north from the deep south to Tennessee and Kentucky. Florida still continues to struggle with deaths. They have the most daily deaths that they've ever seen. So, and that's continued. Even though case numbers and hospitalizations are declining, they're now seeing their surge in deaths. And I'll just flat out say it's a failure of state government, a complete and utter failure of state government. Same with Texas, same with Louisiana, same with the entire Deep South. I'll just flat out say it. It was a complete failure of leadership in those regions that are causing this. So, and now it's starting to spread into Tennessee, Kentucky, you can see West Virginia. But what's interesting is that there seems Ohio and Indiana, southern parts of Ohio and Indiana, it seems like the upper Midwest and the Northeast are still doing okay. They're still doing quite well. So that's hopeful. Same with the upper Midwest, Minnesota, Wisconsin, Michigan, with the exception of the UP. But again, the UP culturally is not too dissimilar from the South, politically and culturally. And you might say, well, look at upper state New York and northern Maine. Same thing there. These are rural areas of the state that have a culture that's very similar to rural cultures in the West and the South, quite honestly. So lower vaccination rates, less likely to wear masks. But in the areas, particularly in urban areas, numbers remain low. And that's a pattern you see all over the country. Rural areas are seeing surges. Urban areas, yes, they're seeing surges, but not to the degree that rural areas are. So, yeah, I think the illustrative examples are Washington State and Oregon State. You're seeing these huge surges, and everybody thinks Oregon, Washington, those are liberal states. Not really. The Portland area, Portland-Eugene area, the Willamette Valley is. The Seattle-Tacoma area, the Puget Sound area is. But the rest of the state is very rural, very, very conservative, and culturally, there's a movement in eastern Oregon to break away from Oregon and join with Idaho. So these are areas that are these are very big states and quite diverse in terms of politics and culture. So yeah, so urban areas are doing okay by and large, and you can see this in Utah too. The Wasatch Front is doing okay. The rest of the state is not necessarily. So by state, Texas is now leading the way. Texas is #1 in terms of cases per day. Florida has ceded the #1 spot. So cases in Florida are declining. So that's really good news. Yes, I agree with you about DeSantis and Abbott, Kirsten. It's a failure in leadership. Editorial note. You've probably seen all sorts of just chaotic scenes at school board meetings. School board meetings were the most boring meetings ever. No one wanted to go to school board meetings because they dealt with some of the driest, most bureaucratic BS that you never just, Now, superintendents in Utah said, no, we don't want the power to impose mask mandates because we don't feel safe having school board meetings. That's how bad it is. They don't feel safe, literally don't feel safe. You probably saw that I posted a video of a boy pleading with the school board, saying that my grandmother died because someone was unmasked from COVID, and people behind him were snickering and laughing at him. That's what that's become. So to me, that's a gross failure in leadership, because state governors, state governments should be taking the heat for that, not school superintendents, not school boards. They never signed on for this. The governor should be taking heat for that. They should impose a mask mandate, and they should be taking the heat, not passing the buck to locals. It's a complete and utter lack of leadership. Anyways, so editorial over. Back to this. So you can see, yeah, Texas is now number one, but their numbers are plateauing as well. You can see Florida has declined, as well as California. So California didn't peak very high, because California does have a fairly high vaccination rate. So that's the thing. I mean, you're going to see surges all over the country, but the surges are much more pronounced in states with low vaccination rates. Okay. So from a per capita standpoint, Tennessee is now number one, South Carolina, Kentucky, West Virginia, Alaska's up there. So you can see that. But even if you look at these numbers, the surges aren't as pronounced as they were before. And these are, of course, the states with the lowest per capita rates: Connecticut, Maryland, Michigan. I'm just skipping over some of the territories here. Maryland, Michigan, New York, Massachusetts. Again, states with relatively high vaccination rates. The exception here is Michigan, which, again, it's like two states: the Detroit metro area and the rest of the state. Very, very different states. Very, very different parts of the state. Yeah, so you can see that most of the states, with Michigan being the weird outlier, have vaccination rates in at least 60%. Some of them close to 70%. Yeah. And you can see the surges. Maine is seeing a bit of a surge, again, driven by those rural areas up north, which are, again, very rural, culturally very not dissimilar to rural parts of the South or the West. Ohio, West Virginia, you can see that shift up north. Idaho is seeing a huge surge, particularly in the Panhandle. We are seeing a surge, unfortunately. We'll get to the Utah numbers in a bit. But the good news is now there are states that are in decline. So for the longest time, there were no states. Every single state saw an increase. So there are now states seeing declines. And these are the states typically that saw the surge and now are starting to go down in response after the surge. So, but there are also some states that never saw a significant surge that are starting to go down. So again, the vaccinations are working. So you can see New York, Maryland, they didn't see much of a surge, but they're starting to plateau and go down, which is great news. I was really worried that these states would continue to go up and maybe the surge would shift to the Northeast like it did in previous years. I was hoping I wouldn't see that because, of course, the Northeast is highly vaccinated, and we're not. So that's really good news. That vaccination has worked. We'll see in the next few weeks. Maybe that will still happen. I'm hoping not. But this is good news that you're seeing declines in New Jersey, New York, Maryland, Connecticut. Even though they didn't see much of a surge, you're starting to see declines. You know, and Oregon, you're seeing declines. California, you're seeing declines. So yeah. And even Mississippi, Florida, they're seeing declines. Louisiana, now Louisiana numbers are really kind of sketchy because, again, they're dealing with the aftermath of Hurricane Ida, and those numbers, we expected those to go down because of reporting issues. Again, they have other priorities right now, so it's hard to say that it's a true decline or is this a reporting issue. All right, so in terms of hospitalizations, Texas now leads the way again. Florida hospitalizations have declined, which is good news. From a per capita, however, Florida still leads the way, along with Alabama, Georgia, Kentucky, Mississippi. Again, all states with very low vaccination rates. Yeah, all of them. There's no exception here. Yeah, right down to Wyoming, which is 40%, which is absolutely atrocious. Yeah. And then deaths, that's daily average. And then per capita, again, mostly in low vaccinated states. Florida, again, is a weird exception, but Florida, if you look at the vaccination map of Florida, the urban areas are pretty well vaccinated. It's kind of the panhandle area that is very, very low vaccination rates. So that 54% is really misleading in some ways. Okay. In terms of vaccinations in the US, we're now at 208 million doses, only 53% fully vaccinated. So when we're seeing countries at 80% fully vaccinated, it's embarrassing. Broken down by age. The good news is that over 65, it's much better, 82%. Bad news is that means that 18% are not fully vaccinated and highly susceptible to severe COVID and death, because this is the most susceptible population. 12 and up is getting better, so that's good news, but it's still not there yet. The bad news is this: the numbers we've declined again. So any surge that we saw from FDA approval and the fear of COVID is now gone down. It's gone now. We're back down to 786 doses per day. Could that be due to Labor Day? Possibly. That could possibly be it. Maybe people didn't want to go because they didn't want side effects over Labor Day. Hard to say. I'm hoping that next week we see another bump in another increase. This was temporary, and some of the daily vaccination numbers may indicate, so you got this little spike in numbers here. We'll see. We'll see. What'll be really interesting is President Biden's announcement about the vaccine mandates, what effect that has. I'll get to that in a bit. To get to that, I should probably move faster with this. Vaccine, you can see where we're vaccinated. Overall, there has been increases in the South, so that's good news. Not enough, though. We still need more vaccination, particularly in children, but of course, we don't have. By the way, there was actually a news story saying that Pfizer and Moderna are just about ready to submit for FDA approval, which means we may see FDA approval for at least 5 to 12 in the next month or so, which would be amazing news, which would be absolutely amazing news. Then the trick will be getting the shots in the arms. And that's the much harder part. So you can see nothing's much changed here. This is what I meant by Florida. You can see that the urban areas around the Miami, Fort Lauderdale area are highly vaccinated, but you can see up in the Panhandle, it more resembles Alabama and Mississippi. The good news is Alabama and Mississippi, there was a bump in vaccination in those states, I think because of the Delta surge. Nothing like kicking your butt to get vaccinated than seeing your hospitals filled up with cases. I wish you didn't have to resort to that, but at least it got people vaccinated. That's all I can say. Wyoming remains Wyoming. Idaho they don't even have data. Idaho is another situation that it's heartbreaking. Their complete absence of public health in Idaho. So by state, Hawaii, this is sorted by 18 to 64. So Hawaii, 89% of their 18 to 64 population and more than 99% of their 65 and older population are vaccinated. That is amazing. 12 to 17, they're 72%. So their surges are due to the tourism. And again, it's one of those things where it's a highly tourist dependent economy. So yeah, I don't know. Yeah. Massachusetts, Puerto Rico is doing really well. Massachusetts is third, doing really well. Connecticut, I have friends from these states ask me, hey, I'm really nervous about school. I tell them, well, you got to be careful, but you're also in states with a high degree of population immunity, and that's going to help protect children. They also are much more likely to have mask mandates at the school levels, as well as vaccine mandates for faculty and staff. And we'll talk about that. that's the way we're going to protect these kids until they can get vaccinated, which is coming soon. Vaccinate as many people around them as possible to provide them with that herd immunity, okay? And enforce mask mandates. Anyways, on the other hand, if you are a parent in West Virginia or Wyoming or Mississippi, I don't have as much confidence. You will see kids get COVID there. You are going to see surges in schools. And you're going to have transmission to households. I wish I could say that you won't, but you will. It's going to happen. You might have entire classes infected. Low vaccination rates, lack of masks equals indoors equals spread of COVID. The vast majority of those children, it's not going to be serious, but there's enough kids that are going to get serious COVID. It's going to overwhelm hospitals. I wish I could say otherwise. Okay, that's grim. I know. We'll talk about that in a second too, a little bit more in depth. Let's talk about Utah cases. We are on our little steady increase up. Did we get numbers today yet? Kind of curious. So I need to check my phone. Just checking today's numbers. I guess not. Okay. But yeah, I mean, we had what did we have, over 2,000 again just recently. So our numbers, we aren't seeing these huge spikes. We're just seeing the steady increase, which is really kind of interesting. We're not seeing the huge spikes that we see in some other states and some other regions of the world. They're just kind of the steady increase. It's kind of interesting. I'm not quite sure why. But here's the thing with Utah numbers. Our hospitalizations, they're kind of matching. Even if our cases, the number of cases is not exceeding our peak in the winter, our hospitalizations are approaching the peak very quickly. And that's really concerning. So we're getting a lot of serious cases. Part of me wonders whether that is associated with the really, really, really bad air quality we've been having. COVID plus really, really high PM 2.5 particulate matter levels equals more symptoms and serious symptoms. Probably. Okay. I'm going to skip over this. I think this is kind of pointless by looking at it by count. Of course, Salt Lake County is going to have the highest numbers because it's the most populous. By per capita, though, Piute County, Duchesne counties, all the counties here they're all rurals. Grant County is seeing the surge, which is really concerning. Grant County also has really high vaccination rates and mask wearing, but they're also highly, I think, Labor Day, I think everybody went down there to Moab, and they've been getting a lot of visitors. So that's going to cause surges. That's what you're seeing in Grant County. But you can see that the first Wasatch Front County is Utah County, and it's pretty far down at 45 per 100,000. And of course it would be Utah County because Utah County has the lowest, significantly lower vaccination rates than the rest of the Wasatch Front counties. Then you have, let's see, Davis County here, Weber County, and then Salt Lake County. Salt Lake County is actually doing quite well in terms of per capita in the state. It's pretty far down. Okay, so again, what's the difference? Vaccination rates, mask wearing, adherence, and I have some data on that too. I'm going to show you in a second. Hospitalizations, again, you know, Salt Lake County is kind of middle of the way, but not up at the top. It's the rural counties and Washington County. Washington County makes sense given that it is a older population, a lot of retirees in the St. George area. But then Kane County, Iron County, Duchesne County, a lot of rural counties. And then deaths, again, the rural counties are kind of dominating this. I mean, Salt Lake County's on there, but we're way down at the bottom. Something that was expected. So tests, we are testing more. That's great. However, there is an issue with testing right now, and that is there's lots of lines right now, unfortunately, and there's a huge demand for tests. So I think the state and local health departments are scrambling because they kind of dismantled a lot of the testing infrastructure, but now they're scrambling to implement that again because of Delta. But this is good news that we are testing more. So our test positivity has gone down a bit. It's not indicating that we are not seeing a surge. It's just that it's indicating that the number of tests have increased. So again, this is the unreliability of test positivity as a measure. You got to look at all the metrics to determine, okay, is this a surge or not? Hospitalizations, like I said, we're full. We're actually rejecting requests from neighboring states to accommodate cases because we don't have enough. By the way, our hospitalization capacity, people think hospital capacity is literally physical space or equipment. It isn't. It's personnel right now. We have space, we have equipment, we don't have trained personnel. We've already had pre-COVID, we had a shortage of clinicians. And during COVID, a lot of those clinicians left the field because of burnout. And this is so a lot of the shortage in hospital staff, hospital space is not due to actual physical space or equipment. It is due to trained personnel. And that's something that we can't just remedy immediately. It takes a long time to train people. You can't replace years of experience. So that's something that we need to talk about if we're going to prepare for the next pandemic, which it's not a matter of if, but when. Right. And then deaths, we are seeing a surge in deaths, not as bad as before. In terms of vaccinations, you just kind of slowly vaccinating. We're now at about over age 12, about 62% fully vaccinated over the age of 12. So that means 38% of eligible people are not vaccinating. 38% are basically, COVID farms. I know that's a horrible thing to say, but yeah, that's kind of what you are. And this is depressing. Nationally, we saw a surge in vaccinations. We saw a little tiny one, but that didn't last long. Our vaccine administration is down again. So depressing. You can see again, what's really, I just paying attention to like Juab County, Sanpete County, Piute County, Uinta County, those numbers have not budged. I mean, we're talking about 28% fully vaccinated. That's of the population, but that means just so few people in Juab County. I mean, yes, it's not a very populous county, but still, it's just, I don't have much to say about it. It's depressing. It hasn't budged. Summit County, on the other hand, 72%. Their vaccination number keep increasing. So that's good news. Grand County second now, then Salt Lake County, Davis County. So it's nice to see two of the Wasatch Front counties up in the top 5 with Davis and Salt Lake County. It's sad seeing Utah County so far down at 41%. So we're talking about a full 14 to 15% less than Salt Lake County. Broken down by age, over 65. Yeah, it's good. 12 to 15. It's getting better. That age group, actually, the vaccination is increasing. So that's really good news. It's now 50% of 12 to 15-year-olds now with at least one dose. So the hope is that those with one dose that haven't gotten the full vaccine will eventually get that. So that is good news. Over 16, it's about 64% fully vaccinated. So, and you can see this here, that that 12 to 18 group is really catching up to that 19 to 29 group. Okay, so again, we need to focus on younger populations, get them vaccinated. But again, at least those curves are kind of not flat. I don't know. I'm trying to find some some optimism here. Okay, breakthrough cases. So again, I encourage you to look at this site on the coronavirus.utah.gov. And this is under trends, or no, excuse me, it's under risk factors. And it shows you, again, how many times, it shows you the relative risk of how much more likely you will be hospitalized, get infection, or die from COVID if you're unvaccinated than if you're vaccinated. So this is really nice. Again, great data on breakthrough infections. Okay, and you can see 5 times greater risk of dying from COVID-19, almost 5 times more likely to get COVID if you're unvaccinated. So this is really, really good data. And you can see here the rates. This top one is rates of COVID for unvaccinated, and this green is vaccinated. So you can see vast differences in vast differences in rates for vaccinated versus unvaccinated. Vaccines work. Okay. Now this is interesting. So the state has started to publish this, or maybe I just didn't see this before. This is based off the BRFSS. So BRFSS is an annual survey that the CDC does, all 50 states, and it's just a survey of health behaviors. They've since started to ask about mask wearing. So this is a random survey, a very scientifically done random survey, and it determines a whole host of health behaviors. BMI, diet, health behaviors like smoking, et cetera, and they've started asking about mask compliance. And this is the mask wearing compliance, and they've done it just about they have data from every week. So you can see, starting from just recently, as much as April, in the state, we're talking about 60-70% mask adherence. And that dipped down to about 25% in the summer. And that's when, heck, I stopped wearing a mask. And then it kind of stayed there. Hasn't really budged. Now you can break it down by sex, and you realize that women are much more likely to comply than men. There's no surprise there. And what's interesting, though, there isn't much of an age difference in men or women. It doesn't. You would have thought that those over 65 would be more likely to wear masks, but not really. And among women, 35 to 49 are least likely to wear masks, but 18 to 34, actually, women 18 to 34, mask compliance is actually pretty good. It's, well, not great, but it's better than any other demographic in terms of age and sex. And then this is by county. And most of us who live in Utah are going to be like, well, yeah, no duh. Highest compliance in Grand County, so Moab area, which is great. Then Salt Lake, not a surprise. I see the difference if I go towards the Utah County side, Lehigh and Alpine, versus, say, Sandy and Holiday and Draper. I see a huge difference. Weber County actually has some good compliance. In terms of Wasatch Front County's Utah County, and this is, anybody who goes to a Home Depot in Sandy versus a Home Depot in Lehigh will know the difference. Now, some counties, holy crap. Sevier County, Emery County, we're talking about no compliance, essentially. Some of these states, again, some of these counties, there's just not enough numbers, so that's why you don't have data. But yeah, you can see a big difference between rural counties and urban counties on this map here. Tooele County actually is pretty good. Summit County, not bad. Okay, so that's Utah data. I do want to go over okay, so back to this study. This has been kind of something that I've been obsessed with, especially when looking at our present surge and looking at the numbers. Are we actually declining? This study, I kind of went over it last week quickly. I want to go over it again because at this point, absent another variant, right now there's a few variants of concern, but I just don't see anything that's going to trump, sorry, bad choice of words maybe, trump Delta, because Delta has the big advantage of transmissibility. Short of that happening, another variant becoming dominant, the way we get out of this is we increase the amount of population immunity to Delta. That means getting as many people as possible with some immune response to Delta, preferably through vaccination, but natural infection is another way to get immunity. So if we start getting more and more people with some immunity to Delta, this is when we start getting that balance between us and the virus. We're not going to get rid of it. It's going to be endemic, which means that we're going to have to learn to live with it, and it's going to have to live with us. And that probably means it becomes like a seasonal flu or severe cold. Yes, it will cause disease. It will cause hospitalizations. It will cause deaths, but not to the degree. The risk of that happening is going to decline as more people get some immunity to COVID. So, but where are we in terms of immunity? How many people have been exposed? How many people are vaccinated? That's a big question, right? Delta has shown that it doesn't take many people to have, it doesn't take a lot of people to be completely, new to COVID to cause surges. Israel and the UK has shown that. So it doesn't take a lot of, it just takes just a few COVID naive hosts to really cause surges. So where are we in terms of how many people have had COVID? So the best way to do that is do seroprevalence studies. Check for antibodies in the population. Now, I've gone out and said that antibody tests for individuals are kind of pointless, but on a population level, they can be really, really useful. So this is called a seroprevalence study. So administer antibody tests on a sample of the population to determine how many people have had COVID. Now, we have different antibody tests that detects vaccine-mediated immunity versus natural immunity. Okay, so we're able to kind of differentiate that. And this study did exactly that. But the big caveat here is that they did it on blood donors. I can understand why they did that, because that's an easy population to do. We have millions of blood donors, and we still happen to have their blood. So it's kind of handy. So we did this, and this was on several million. This was on, let's see, give you 1 million, 1.5 million, more than 1.5 million samples. And they have it by time. So this is really, really good. And according to this, and this, by the way, represented 74% of the US population. Okay. And they broke this out by age, race, ethnicity, geographic areas of residence. And what they found was combined seroprevalence, combination of infection-induced prevalence and vaccine-induced prevalence. They found that more than 80% of the sample had some level of immune response to COVID, which is great news. Maybe COVID is running out of COVID naive hosts to infect. That would be great news. And you could break it down by region. Some regions had some seriously high. So again, it has a limited catchment area. Only 85% of the country was represented by the sample, but you can see some areas of the country really high levels of immunity. Okay, and then this broken down by area. There's actually some other observations here that are interesting, but I'm not going to get into those. Here's the issue, though, with this study. Blood donors are probably different from everybody else, right? And this is only blood donors. The question is, are blood donors more likely to be vaccinated? Are they more likely to comply to masks? So there's a lot to sort out here. I think I might write a long analysis of this. I might actually toss around an idea of starting a Substack site. I think I will, because I think this deserves more in-depth analysis, because the biases go in different ways, and yeah, I think I'll do that. But I think, it's an interesting. I think we may be hitting. I think there's a lot. I've always thought that there's a lot more folks who've been infected who have asymptomatic disease. By the way, this study also ended. This is up to May 2021. Pre-Delta surge. Post-Delta surge, could we have 80 to 90% of the population in some way, either through vaccine or through natural infection, be exposed to COVID, to have some immune response to COVID? Maybe. It's a tough one. I think, yeah, and there's some epidemiologists that agree with me that if that's the case, this might be the final big surge, and we'll see smaller surges, especially over the holidays, but they're not going to be nearly as bad as before. Again, big caveat is that there's not another variant out there that's going to take over for Delta, and I don't see any indications there are. And I have my own reasons to think that there are a very limited number of variants that you can have that are going to have an effect on COVID. Could we be approaching that point where we're just going to start seeing smaller and smaller surges? We're going to see surges. They're going to be smaller and smaller and smaller. They're going to result in less and less hospitalizations and death. I think we might be. Maybe. I have some huge caveats there, but I think this might be the last big surge. Again, subject to change with the data that's coming in. By the way, we can speed this up by just vaccinating. It's just, if we can vaccinate more and more people, will COVID disappear? No. But again, we will get to a point where we can just coexist with it. And that's all we can hope for right now. That we'll all get it, but we'll get it back when we have some immune response. So it's not a big deal for most of us. That's all the best we can hope for at this point. All right. So that's my commentary on where trends are going right now. I kind of went on a limb. We'll see. We'll see if the limb breaks. But yeah, it's kind of hopeful. I don't know. I'm kind of hopeful. Kind of. But that's subject to change on a dime. Okay, a few more minutes. So let's talk about kids, school starting. That's a big topic right now. I put out a post on social media about looking at the South versus New England in terms of their huge spike in cases, especially among school children. Just so happened on the same day New York Times published this. I wish I saw that earlier. I could have just shared that. They have much neater data than me. I don't have time to do all this stuff. So anyways, this is from the New York Times. They looked at 10 states with low vaccination, 10 of the lowest vaccinated states, and 10 of the highest, and compared the numbers by age, compared the spikes by age. So this obviously, this huge spike here is over our last holidays, winter holidays. And then this is our present surge. Okay. And this is hospitalization. This is just hospitalization. So you can see under 18, there's definitely a surge, but it's not very high compared to 70 and over. And of course not, because this is the least susceptible group. But you start looking at the 70 and over, compare that to the previous surge, you can see that it's much smaller. This surge is much smaller. Look at the under 18. This surge is much larger. So from a percentage standpoint, this recent surge, the hospitals are filling, it isn't anecdotal, the hospitals are filling up with younger and younger people. By the way, I want to specify that there's no evidence that Delta is any more severe than Alpha or any of the other variants. In fact, I was just going over the data, and a lot of epidemiologists would agree with me. There's no indication, no solid data to show that it's any more serious. Seems like rates of hospitalization and deaths are about the same as Alpha and the wild type. It's not as serious. It doesn't cause more hospitalization. It seems like that because of the increased hospitalization among children, maybe, but it's not any more serious. So that's good news. The big thing with Delta is just way more transmissible. And that's what gave it the huge advantage, is transmissibility. Deadliness doesn't really give a huge advantage to viruses from an evolutionary standpoint. So anyways, you can see the 10 most vaccinated states. So before that though, you definitely see a surge in children, okay? And it's much more significant than during the winter holidays. But if you split it out by the 10 most vaccinated states and the 10 least vaccinated states, yes, in adults, there's going to be a surge, but it's not nearly as big as in the 10 least vaccinated states. And look at the under 18. It's really not much of a surge at all. It's pretty flat. Whereas in the 10 least vaccinated states, huge surge. So a lot of this, again, is the fact that so many people around our kids are vaccinated, that's going to inhibit transmission of the virus. Yeah. But yeah, yes, cases in children are higher than ever, but it's really, really concentrated in those states with low vaccination rates. And this is exacerbated by the fact that in these states, mask mandates are also, in many cases, outlawed. They're illegal to have mask mandates. So you have schools without mask mandates where very few of the adults surrounding them are vaccinated. There's no vaccine mandates for teachers. You're gonna get outbreaks in those. And and here's the other thing. We're probably detecting more cases in children. Why? Because we're testing them more. Because they're in person, a lot of schools have testing protocols. Some schools test weekly. So we're going to catch a lot more cases. But that's true, but that doesn't explain this difference. It might explain the difference between now and the previous surge where we didn't test school kids. A lot of them were actually still remote. But it doesn't explain this because, quite honestly, actually, these states, the most vaccinated states, their testing protocols are much more robust than the least vaccinated states. So you could actually argue that this is actually an underestimate. The rate in children in the 10 least vaccinated states is probably an underestimate. It's probably higher than this because their testing protocols are less robust than in the most vaccinated states. They have very tight testing protocols. And even with the tighter protocols, they're not seeing a bump at all. Some of this may be due to the fact that, especially in New England, schools haven't started yet. We may still see a bump because schools just started in those states. We'll see. This is something worth keeping an eye on. Did want to share some more detailed data on this, but I think we're running out of time. And again, I didn't get to half the stuff I wanted to go to. This is hospitalization data again. This was to emphasize the hospitalization rates by age in different regions of the country. And but yeah, this is that study that this just tells you how infectious Delta is. The study back in Marin County, California, how quickly it spread to half the students. 50% attack rate in students because of one briefly unmasked, unvaccinated teacher. So you imagine in the South where this is where everybody was wearing masks. Imagine a state where no mask mandates, no vaccine mandates. How rapidly is it going to spread in those? In those areas, yeah, it's going to spread very rapidly. The fact that 50% of this one class was infected, this is extraordinary how quickly COVID can spread, Delta can spread. So I'm a firm believer in in-person classes. I think we've already done so much damage with COVID, especially in our young children. I think it's really important to be in person. That said, we need to have strict mask mandates. Masks work. Again, there's studies. We had that recent study in Bangladesh that showed how much masks work. So strict vaccine mandates. I mean, a teacher just pulling it down briefly is enough to spread it to half the class. Strict mask mandates, okay, combined with vaccine mandates for faculty and staff, and increased vaccination for all the adults around those children. If we don't do those things, I think it is safe to be in school. The problem is, in many parts of the country, neither of those things are being done. And in those areas, you're going to have huge outbreaks of COVID among school children. You're cramming kids, 20, 30, in Utah, close to 40 kids in a classroom, indoors, no mask mandate. Maybe half the kids are wearing masks. Teachers that don't have to have vaccinations, don't have to wear masks. In areas where only 30% of the population is vaccinated, you're going to have huge outbreaks. Okay. By the way, this is just more evidence, more studies showing how effective the vaccines are against hospitalization. Every week, more and more studies are coming out. Sorry, I don't have time to go over it in depth. I'm going to probably start a Substack site where I can actually do this stuff, as if I have a lot of time to do this. But this is something that I think is part of my job to translate this into something that most people can digest. So I'm going to start doing that, I think. But this is an interesting study, transmission of SARS-CoV-2. I will go over this real quick. This is a study out of Scotland. They recruited a bunch of Scottish healthcare workers. They were the first to be vaccinated, of course. And they were looking at the workers pre and post vaccination. And they also followed their households. So the households of the healthcare workers pre and post vaccination. What they found was, and they were really focused on the households so not just pre and post. Okay, what I meant was, so the folks who were getting vaccinated were the healthcare workers. The households, of course, were not eligible for vaccination until much later. So they were looking at the household, transmission within a household, based on whether the family members who are healthcare workers are vaccinated pre and post vaccination. What they found was, after the risk of transmission in the households was significantly less after the healthcare workers were vaccinated. What does that show? It's strong evidence that the vaccines do prevent transmission. Now, this is pre-Delta. Delta has shown that it is more transmissible even for those who are vaccinated. But again, evidence shows that it isn't equal. Unvaccinated are not equally transmissible as vaccinated breakthrough. More and more studies show that, yes, vaccinated breakthrough cases can transmit, but the viral loads are much lower, and the period when they can actually transmit is much lower, much shorter. Vaccines do prevent transmission. Are they 100%? No, nothing is, but they do definitely inhibit transmission. So, yeah, you want to prevent transmission in schools, strict mask mandates in schools, vaccine mandates for everyone who's eligible. And that's the route that we've taken at Westminster. And that's why I can come into class feeling relatively safe, that we're not going to have huge super spreader events on campus because everybody indoors is wearing a mask. And by October 15th, everyone needs to be vaccinated or have a religious, or I'm not a huge fan of religious exemption, or medical exemption. All faculty, staff, and students, everyone within the community. We are not allowing personal exemptions because we don't have to follow state laws. State laws indicate that you have to allow for personal exemptions. The use personal exemption notification thing is just a checkbox. At that point, you can't even call that a vaccine mandate because you can just go online, check a box, and that's it. You have a personal exemption. We're not allowing a personal exemption. Religious exemptions, you have to talk to our Title VII coordinator and explain to them why there's a religious exemption. And religious exemptions, with a few exceptions, it's not really a thing. So, okay. Yeah, this is a bang. So I wanted to really cover today, and I didn't get a chance to. There's a really great poll, and I will talk about this next week. And in fact, I will move this up next week because, of course, President Biden just announced he took leadership. He really did. He knew there was going to be backlash, and every single Republican governor is now just had a stroke about this. But yeah, he really took leadership, and these vaccine mandates can make a huge difference. We'll see where this goes because it just stirred up a political hornet's nest. See where that goes. But a lot of folks saying, oh, Biden's through. He's pissed so many people off. I don't know if that's the case because of this poll. What Americans think about people who are not vaccinated. It's really interesting data. Okay, and I'll go over this next week in depth, or maybe I'll do a Substack on it. There's also another one. And this came out a few weeks ago, by the way. High public support for mandating vaccines. And this poll shows that, you know what? A lot of us are very much pro-vaccine mandates. So this may not be politically damaging to President Biden. It might actually be applauded by many people, regardless of what Fox News and the Republican governors, they about blew a gasket, which means that, to me, is an indication that maybe President Biden has done the right thing. I'm sorry, okay. Trying to make this non-political. But yeah, so I think there's a lot more folks who are very pro-vaccine than people and pro-mandate than people think. So just, as a summary, 20,000 people survey. This was back, by the way, just as Delta was surging, 64% approve of requiring everyone to get a COVID-19 vaccine. That's a lot of people. 70% requiring COVID-19 vaccine to get on an airplane, 61% requiring children to get a vaccine to be allowed to get into school, and 66% requiring college students. There's actually a strong majority of people who are very much pro mandates. And you can break it down here. So we'll kind of go over this next week because I think this is really interesting data. And so I think politically, this was not such a bold move by the president. I think it was a very good move by the president. So anyways, I'll go over that first thing next week after the numbers. So I apologize. I was going to go over that today, but we're just running out of time. So I will start a Substack. I'll try to get some time. I'm also in the process of moving, so that's going to take away some time. In fact, there may be a Friday where I might not be able to do a brown bag, in which case I'll try to do more Substacks and more posts like that because I do enjoy doing that. And it is something that I really feel strongly about. Translating epidemiology so that more folks can understand it, because I think that's one of the things that we don't do well in science, especially epidemiology, is explaining things. So I will do that. Otherwise, please have a good weekend. And if you have any questions, please, you know how to contact me. Feel free to shoot me questions or comments. I'm more than happy to read those. And otherwise, I will see you next week.